You're watching Canadian Muslim News on Muslim Network TV from Toronto, Ontario. I'm Samia Sayed. Welcome to another show. Now, coming up is a discussion on the opioid crisis and how it targets low-income Canadians. But first, let's take a look at the headlines. Freedom Convoy organizer Pat King appears in Ottawa court. Manitoba's First Nation searches for unmarked graves. Ottawa police investigate shooting at a Muslim funeral. Hamas spokesperson states Biden's visit only to serve Israel. And now the details. Pat King, the organizer of the Freedom Convoy, appeared for a bail hearing today in Ottawa. He was charged and arrested on February 18th for his involvement in the freedom protest in Ottawa earlier this year that hijacked the Capitol. King's previous bail review in April was not concluded as his lawyer's computer seemed to be hacked during court proceedings. During an unconcluded hearing, he was further charged with obstruction of justice by the Crown. King proceeded to hire a new lawyer to legally represent him against a number of charges. The details of charges laid on King are protected by a publication ban. Pimi-Chikamik Cree Nation Chief David Monias said Monday that the First Nation has started its search of unmarked graves in the surroundings of Manitoba's former Roman Catholic residential school. Monias said that the search at St. Joseph's school site will be conducted with ground-penetrating radar search, which will likely take 2 weeks. He says, however, the examination of the findings may take several months or even up to a year. The chief said that 6 community members will take part in the search who are currently being trained to use the equipment. St. Joseph or Cross Lake Indian Residential School was operational from 1915 to 1969 when it was closed down. Ottawa police are investigating an incident of multiple gunshots at the funeral of a homicide victim, Abdulhamid Haji Rajab, on Friday around 3 p.m. at the Ottawa Muslim Cemetery. The gunshots led to a non-threatening injury of a man who was moved to the hospital. 24-year-old Haji Rajab was shot dead last week in a community housing neighborhood in South Ottawa. The police are searching for the shooting suspect. Meanwhile, Chan Lemieux was charged with second-degree murder of Haji Rajab on Friday. As President Joe Biden begins a visit to Israel and the Palestinian territories, journalists from the Palestinian Media Forum gather to call on the U.S. president to, quote, stop siding with the Zionist occupation. The crowd demanded justice for the slain Al Jazeera journalist Shireen Abu Akleh, who was killed while covering an Israeli army raid in Jenin in May. U.S. President Joe Biden is to start a Middle East tour in Israel today before a delicate stop in oil-rich Saudi Arabia. Palestinian resistance group Hamas said U.S. President Joe Biden's visit aims to serve Israeli interests at the expense of the Palestinian cause. The Hamas spokesperson went on to call for rallying efforts against Zionist and U.S. policies and enhancing relations with forces of resistance. That's it for the news. Now, a recent study has found that opioid harms have reached a crisis level. This study looked at opioid deaths across 17 years and noticed that low-income Canadians were nearly 4 times more likely to die from opioids. To give us more details on the study is Professor WASEM ALSABBAGH, a pharmacy professor at the University of Waterloo and the lead author of the study. Welcome to the show, Professor. It's great to have you join us today.
Thank you so much for having me.
Brother Waseem, can you tell us more about your study? What exactly were you looking at?
So we know that opioids harms, that includes death as a result of overdose, going to the hospital and going to the ER, affects every Canadian. It is a crisis that we are living in right now. However, what we looked at the areas in Canada divided by the income level, and we looked at the number and rate of those opioids harms and to see if there is any difference by the area income level. And we found that Canadians who live in the low income areas have almost 4 times the mortality rate, the hospitalization rate, and almost 5 times the number of ER visits as a result of opioids overdose.
Mm-hmm. Now, based on these statistics, what trends did you notice across them?
Well, we found that the gap was reducing over time for mortality. So in the most recent year in the study, we found that it's almost 2.5 times. Still, it's a big inequity in terms of the effect of the opioid harms. For the hospital visits and ER visits, we found that there was no change. The inequity was stable. The most recent year was 2012 that we have data for, and we found that it's still about 4 to 5 times the rate in low-income areas in comparison to high-income areas.
Mhm. Now, you've given us a lot of statistics here, but if we try to translate this into explanations, what does this gap for low-income Canadians' prevalence in opioid deaths mean or even suggest?
Well, we know that no one is immune against having an opioid harm. No matter who you are, where you live, what kind of family you grew up in, what type of education you have, everybody is prone to this crisis. However, those who are living in low income areas look like they are more vulnerable to those effects. This might be a result of having less accessibility to material aspects, for example, affordable housing, stable economic opportunities. In addition, it might also represent lower access to social support. So somebody to lean on if you have a stressful situation in your life, somebody who you can look up in the time of difficulties, somebody who check up on you. So it cannot be only about material aspects. It must be also taken into account the social aspects of the crisis. So both having sufficient material means as well as the social capital, meaning people to support you.
Mhm. Now, from what I understand, it is also minority groups like Indigenous groups that exist within this low income bracket. Can you give us some more details for this?
Unfortunately, indigenous population is at a very high risk of opioids harms. For example, we know that the indigenous population represents almost 2.6% of the Canadian population. However, their mortality is almost 10% of all opioids harms, which means it's almost 4 to 5 times the rate among the indigenous population as opposed to the overall Canadian population. This might be a result of intergenerational trauma. It might be a result of racism, discrimination, lack of economic opportunity. All those working together, all those factors together make the indigenous population more prone to those harms. And unfortunately, a lot of people are losing their lives as a result of this crisis.
Now, you've highlighted the problem, you've analyzed the effect, but what are some ways to address these trends that you found in your study?
Well, we are hoping that our study will enlighten policymakers in their designing of new interventions, new ways to tackle the opioid crisis. That might include multidisciplinary teams that work together, that has both medical professionals and social workers to work together so the opioid crisis can be tackled from the roots of it. In addition, the places where those programs should be implemented should be close to where people at the higher risk. So, for example, the inner city areas, the low-income areas, those are the areas that we are hoping that policymakers will take into account to implement those programs so they have higher accessibility to people. Because let's remember that people with low income have lesser access to vehicles, for example, so they will more depend on public transit. So those programs should be accessible. It should be more understanding of the cultural sensitivities. So when we talk about the Aboriginal population, community leaders should be consulted, should be involved meaningfully to have appropriate interventions to work with the people to get this crisis under control.
Now, you've highlighted some areas where your study findings can be used to appropriately address the issue. But do you think our current healthcare system is appropriately equipped to handle this issue?
Well, there are a lot of interventions that have been made already. So there are, for example, the antidote that is being distributed free of charge in pharmacies across Ontario, for example, and in other provinces as well. There are also the controlling of prescribing. So physicians and nurse practitioners are more educated now about how to appropriately prescribe those medications for the people who need it. So I think that we are starting to do some interventions, but we still have a long way ahead of us, especially after what happened with the COVID-19 pandemic that actually made the opioid crisis even worse.
Now, I remember when there was elections in a local riding close by, there was a candidate that was pushing for a health and addiction center. However, the proposal was wildly unpopular, and ultimately, not only was the candidate not elected, there's no center. Now, I know that this is the case for only one local riding, but it suggests that there is a little reluctance to build these kind of centers that end up helping people. Now, you mentioned that there is a social aspect to this issue. How do you think this relates to the idea of building centers?
I think harm reduction idea is essential to be used as a tool in this fight against the opioid crisis. Harm reduction can have programs such as the safe injection sites, where people have access to clean needles, and also can contain what we call safe supply programs. Safe supply programs means that we provide people who use drugs with medically prescribed clean supply, so they don't have to go to purchase the illegal illicit supply that is usually contaminated, and it's usually the cause of the overdose death. Now, we can only talk about evidence, what the evidence tells us. Those programs are actually very effective in saving lives and saving the healthcare system that we all care about. We know that how much it's stretched right now. So I think we should try our best to gain the minds and hearts of our population that those programs are effective, they save lives, they are essential in our fight against the opioids crisis. My wife volunteers in a local organization that cares for the youth that are suffering from homelessness. She
Mhm.
once cared for a young man who was homeless and who was also using drugs. A few weeks later, she asked, "Where is this person?" They pointed to a picture on the wall saying that he passed away as a result of an overdose. Those people should not be turned into just a picture on a wall. Those people are our sons, our brothers, our daughters. They are our people. We should care about them, and we should find every good way to care for them and prevent the needless death. And safe supply programs and other multidisciplinary programs are one of the tools that should be used to tackle this complex problem.
Well, thank you so much, Professor, for joining us and telling us more about your study and what can be done with its results. It was a pleasure to have you join us today.
Thank you so much for having me.
You are watching Canadian Muslim News on Muslim Network TV. That's it from our Toronto studios tonight. Make sure to like, share, and subscribe to our channel for more Canadian Muslim content. Stay safe, and until next time.